Hello everyone, good evening. I'm Dr. Shilpa and I'm here again doing a live on endometriosis awareness. Hey Dr. Mukta.
Hi, I'm sorry I
Hi.
just couldn't find the live happening. That's why I messaged you.
That's that's perfectly all right. I knew their technology sometimes just acts weird, but that's all right. That's all right.
Yeah.
Because I think today's session is something which I'm like really excited about. A lot of people don't talk about it, with regards to endometriosis, but uh, to be honest, this plays a very important role in actually dealing with endometriosis. So, Dr. Mukta, she's a physiotherapist and a really good one.
Oh, thank you.
So, Dr. So, Dr. Mukta is one of the few physiotherapists in the US with a double board certification in orthopedics and women's health. So because of this dual training, she understands the delicate interplay between the neurophysiology, biomechanics, musculoskeletal, facial, and organ systems, and their combined contribution in a person's overall well-being. In her free time, she is extrovert, so she is biking, running, hiking, and loves being outdoors. And she practices in the New York City, and you can connect with her at Pelvic, the Pelvic dot connection. So welcome, Dr. Mukta. I'm like so happy to have you on our
Thank you
show.
for such a wonderful introduction. I don't know if I would call myself an extrovert, but yeah, I'm kind of like there in the middle. But
Okay.
yes, I do enjoy a lot of outdoor stuff because that's how I understand my own body, and that's how I try to figure out things, what works for people, and help my patients. So yes, thank you for having me here,
And
and I'm so thrilled to be talking to you about endometriosis.
oh, I love your content. The way you explain things is like just so fabulous. Not a lot of people do that, and it is like bang on. You see that post and you understand what you're trying to say.
Thank
So
you. It's a
I
it's
think
a it's a skill set that I have been trying to work on since I started Instagram, and it didn't come easy to me, but I'm always like,
I'm sure.
are people gonna understand this? Can I make it more easy or simple? So yes, thank you. I really appreciate that, feedback, truly.
And also, before I start the session, one question: do you do online consults?
Yeah, I do. Absolutely, I do. Yeah.
Perfect. So this is for everyone who keeps looking for pelvic physiotherapists. So she does do online
And I know,
consults.
like,
So
thank you for asking that because, there is a lot of information online and people are finally becoming aware of what pelvic physical therapy or physiotherapy is. And they're like, we don't have
yes.
access to, like, even in the US, you may feel that, oh, it's such a developed nation, so everyone should have an access to pelvic floor physical therapy. But you would be so surprised that I spoke to someone who is in the Midwest part of the US, and she said that she had to
Mhm.
drive 3 hours to see a pelvic physical therapist. So the accessibility is still a huge issue. Not everyone has access, but I think not just me, but a lot of physios, pelvic physios who are in the social media space are here to help people, in every no matter where you are in the world. So don't hesitate, to reach out. There is information on my page where you can figure out like how to find me and make an appointment.
Perfect. That sounds really good because honestly, for people like me, I struggled to find a pelvic floor physiotherapist when I went through my surgery for endometriosis, and it was like really tough. So let's just begin this session by one simple question. How can physiotherapy help in dealing with the symptoms of endometriosis?
Okay. Before I explain how physical therapy can help, I think we need to understand what endometriosis is. And a lot of times, especially endometriosis, is so rife with different kinds of misconceptions and myths, and that's why the appropriate and timely care is so far behind. On an average, it takes from 7 to 10 years before someone misdiagnosed, with endometriosis, which is mind-boggling in today's world.
Absolutely.
What the hell is going on? Why is it taking such a long time? And I think we need to acknowledge and talk about how the basic symptoms that are associated with endometriosis are frequently dismissed. Women are told, pain with period is just normal. And you would go to your mother or your elder sister and they're like, yeah, I am in pain too. And it's just like so normalized, which is good. Like, you shouldn't be living in a fear of pain, but at least a basic understanding that you shouldn't have, so much pain with your menstruation that you are like skipping school or missing work, or like you cannot even get up. Like, oh no, I just take 3 pills a day and then I'm functional. What happens when you don't take the pills? So I think it is so important to not live under the shadow of fear of pain, but at the same time really acknowledge that pain may not be such a normal thing, and maybe we need some medical intervention. That's something we need to really acknowledge. But pain is something which comes to the mind right away when someone talks about endometriosis, or we think it's only around the menstruation or when you get your period. But that's not true. As you continue with endometriosis, you may experience pain anywhere during your cycle. And a few of the reasons for that is, first of all, let me just say, endometriosis, which is explained as lesions or tissues that are similar to the line that is inside the uterus. Not exactly the same. That's a big misconception about endometriosis. It's not the same, but similar tissues as the endometrial lining, which is the line inside the uterus, are present outside of the uterus. They could go as far as your eyes, your ear. They have seen it in the brain, the diaphragm, which is the breathing muscle. But most likely, the finding of endometriotic lesions have been seen in your bowels, over your bladder, the space between the uterus and the bladder, which is called the pouch of Douglas. It's usually seen, these lesions are seen there. So depending on where the lesions are present, your symptoms are going to be, they will be similar to the functioning of or the dysfunction of that specific organ. So for example, if the lesions are present, in your bowel, in your rectum, or in the lining of the rectum, you may experience pain with bowel movement. You could have constipation-like issues. You could even have IBS-like symptoms, which sometimes are treated as IBS for years and years, only to find later that these IBS-like symptoms were caused by endometriotic lesions. If it is present on the bladder dysfunction like urinary urgency frequency, difficulty of holding urine or pain with urination could also present with endometriosis. So again, like wherever the endometriotic lesion is going to be present, we will see dysfunction in that organ. When it is present in lungs or diaphragm, we see lung collapse with endometriosis. Doctors are like confused why this person is having these frequent lung collapses or difficulty breathing and these kind of issues. So these are some of the symptoms that we see with endometriosis, and based on whether it is pain, whether it is bladder dysfunction, whether it is bowel dysfunction, whether it is sexual dysfunction, we physiotherapy help with management of those symptoms. Again, physiotherapy does not cure endometriosis. It is not doing anything to the lesions that are present in different organs, but it can help improve the quality of life. It can help you with management of those symptoms, so you're not completely bedridden or disabled from those symptoms.
Absolutely. That makes real good sense, because first and foremost, as endo advocates, we have been trying to put this across that it is not the endometrium which is present anywhere else in the body. It's not the rogue endometrium. It is the endometrium-like tissue which is present anywhere in the body. Why this distinction is important is because the treatment completely goes haywire. Everyone is trying to treat endometriosis by giving leupride or HRT, just because they think that it is endometrium. So that's the reason why we are trying to, specifically say that it's endometrium-like tissue, not endometrium. And I'm so glad you said that.
Please talk about the medication you just spoke about, because people may not know exactly what you're saying. So I think that would be great.
Yeah, so the leupride is the injections that are given to suppress your ovaries. So they completely close them, they shut them. So you are pushed into a sudden menopause, and it leaves a lasting side effect like bone pains and a lot of other things, and hormone obviously to again put you into a menopause. So because they feel that your endometrium, your estrogen is what's triggering your endometriosis, whereas the tissue itself produces its own hormone, the estrogen.
Exactly. So yeah, I mean, another treatment that's usually pretty famous is, either have a baby, because that's a solution of every woman's health-related problem on Earth. Have a baby, whether you want a baby or not. Or what's the other thing? Yeah, just remove the uterus. So because if the uterus lining is just present everywhere in the body, then just remove the freaking organ that's causing this.
Absolutely.
So,
absolutely.
Which is so not the treatment for endometriosis, because again, we have to emphasize the endometriosis lesion is not the same as the tissue found inside the uterus. This distinction is extremely important. So coming back to the question you asked, how physiotherapy can help is, so why does the pain actually occur in endometriosis? So there could be a few, there are some theories and some understanding like why the pain is happening. So first of all is the local inflammation that these endometriotic lesions are creating. They, the body kind of considers them as foreign tissue, like what is happening? It's creating its own hormones. So the body kind of continues to create this inflammatory response, C-reactive protein and all kind of inflammatory chemicals that are innate to our body are produced to fight off kind of like what is going on locally, this inflammation, so to fight off these lesions. So that local inflammation can create pain response. Then we have sensitization of the peripheral nerves. We know the nerves are everywhere in the body. It's everywhere in the in the organs that endometriotic lesions are present on. And interestingly, I was reading a study where they said that they are hypothesizing, or they have seen, I don't remember exactly, that endometriotic lesions, just like how they create their own hormones, they're also creating their own, guess what, nerve growth factor, which increases the nerve endings around the lesion of these endometriotic lesions. So when there is more nerve endings and there is inflammation going on, these inflammatory chemicals can keep on irritating these nerve endings, creating the pain in the body. And then ultimately, if you have been gaslighted for multiple years and you have so much medical trauma, and alongside the root cause of the problem is not cured, you're just going from one practitioner to the other, obviously the time elapsed between the onset of the symptoms and the diagnosis, in the meantime, can create what we call central sensitization, which means the brain, which is the master, the boss that kind of deals with the rest of the body, it kind of loses its ability to control pain signals. So it becomes this, how I explain this helicopter parent who is noticing that something is going on in the body and I'm not clearly sure exactly what. So I am going to be this hypersensitive parent who is looking for exactly what's going on and not. So in central sensitization, even the normal sensations, for example, the touch, which is absolutely normal, can also create pain. So we have seen, because of the central sensitization, conditions like that build on top of endometriosis, like vulvodynia. And vulvodynia is, in a nutshell, I mean, it means pain in the vulva, but which doesn't really tell exactly what is causing this pain in the vulva. But because of the sensitization in the nerves, this pain can spread out to the areas where the lesions are actually not present. So it's very confusing for people when they even go for a laparoscopic procedure, which is the gold standard surgical treatment for endometriosis. They're like, the lesion is gone, my doctor removed all of it, and I'm still in pain. Is my endometriosis coming back? And in some cases, it may come back, but most of the times and this is coming from experts like the skilled surgeons who perform laparoscopically all the time, they say if the lesion itself was so microscopic that it was missed during the surgery, those lesions can grow and create the same symptoms as before. But if an endometriotic lesion is completely taken away, very skillfully removed from that body part, it should not grow back. So it's kind of still controversial, and I don't know exactly the whole story about the endometriotic growth happening or not. Some people claim that it does, some say it doesn't. But people, even after the removal of the endometriotic lesion, can continue to experience pain. And why? Because of central sensitization. Because your brain chemistry or brain neurophysiology has changed over the years. So physical therapy can play a huge role in calming the nervous system, kind of reversing the central sensitization process. So yes, if you are experiencing pain, even after the surgery, don't think that your surgery was not correctly performed, although it happens all the time, as you know, like, you know, we don't have as many skilled surgeons in the world. So yeah, I mean, it's a really, really tough thing for an patient who has gone through endometriotic surgeries. Like, is it my central sensitization causing my pain, or should I go for another surgeon, another surgery? What is required? And I think answer to that is you may have to try physical therapy for some time, and you may not just physical therapy. Endometriosis is such a multidisciplinary condition that you need to have a surgeon, a physical therapist, a psychologist to take care of your mental health aspect, and a dietitian who understands how different foods and nutrition is creating a role in your pain perception. And yeah, I mean, I just said these things, and multidisciplinary team is not accessible to everyone. So I'm saying this with a caveat that if you have accessibility, definitely take advantage of it. If you don't have accessibility, then yes, I mean, it is a problem which we should all work towards. And I think that's where endo advocates such as yourself come into the picture, or me from my page, I try to educate people and give information, as much information as I can give, so people can start implementing some of those things when they don't have access to specialists.
Absolutely. So central pain sensitization is something which is so important, because I have gone through it and I know how bad it can get, because the slightest amount of discomfort, the first thing that comes to your mind is it coming back? Because you're like so scared, because it has taken years of pain, years of suffering for you to actually get to a diagnosis and get to a treatment at the end of it. And then again, getting back that pain, it actually shatters you.
Yeah.
So finding a good physiotherapist is something which is really important.
You're very clear. It's very blurry. I don't know what's going on if the internet.
Okay, hold on.
Yeah.
Hold on. 1 sec. Is it a little better now?
I mean, I see myself fine. That's much better. Yes, so much
It's better? Oh. So the network probably was playing a spoil sport. So what I was saying is finding the right physiotherapist who can help you identify whether it is the central nerve sensitization or not is extremely important. So as a physiotherapist, are there any specific stretches or exercises that you focus on or emphasize on which helps you with the symptoms?
So again, great question. And I get this question in my DMs all the time. And I just say, like, I don't know how to answer that because, again, it depends where your endometriosis is, what symptoms you are experiencing. A lot of people end up having pelvic floor dysfunction. And the reason why pelvic floor dysfunction happens with people with endometriosis is, again, that local inflammation and peripheral sensitization. It's almost like the body is noticing something is not right, and it's like it's self-protecting by clenching. It's self-protecting by just tensing up, and you're not even probably realizing that's happening because A, we cannot see our pelvic floor muscles. B, we are not super in touch with our pelvic floor because everything is inside. If you have hamstring tightness, or if your biceps or your neck muscles become tight, you're like, oh wow, yeah, this is very tight, and you will massage it. But for pelvic floor dysfunction, how do you find these muscles? And obviously, coming from a conservative culture, it is always such a taboo that you don't want to touch yourself, you don't want to even look at yourself. Like, how many people know the anatomy of vulva? Like, how many people know the difference between vulva and vagina? Even social media bans us from saying these words. So like it is such a, I don't even know where to begin. And I'm going to start my rant. So let me come back to the main conversation.
No, but it's important. It's really important.
Pelvic floor dysfunction is this tensing of the muscles. And so I'm going to show it with the help of, I totally forgot to keep my pelvic floor model. It's okay. So let's say if your pelvic floor is, it's placed horizontally in the pelvic cavity. So the muscles are sitting like like a trampoline or a hammock. And when they tense it up, they kind of flatten up. When they relax, they kind of go down like this. So I'm going to show this with my shoulders. So this is tensing of the pelvic floor where they are supporting all the organs sitting on top of it, your bladder, your uterus, fallopian tubes, the rectum. And then when they relax, they are kind of like creating the space in the pelvic cavity. We have to relax the pelvic floor when we are peeing, when we are having a bowel movement. We're not thinking about these things. Like if you have to go to the bathroom, you're like, oh, let me relax my pelvic floor because I have to pee. This is a mind-body connection. The brain is giving signal to the nerves that take the message from the brain to the pelvic floor and asks it to relax. And this is happening in split seconds that we are not realizing exactly what is happening automatically in our body. But we also have voluntary control over these muscles, meaning we can, by thinking about it, control the movement of these muscles. So I can tense up my pelvic floor and I can relax my pelvic floor. But this comes with paying attention. This comes with even knowing that, oh, wait, I have been in so much pain and I feel so tense around my belly. Maybe my pelvic floor is also clenched up or tense. Maybe I need to do some stretches to relax these pelvic floor muscles. But not everybody with endometriosis necessarily has pelvic floor dysfunction. So what are some of the symptoms of pelvic floor dysfunction? You may experience pain, like tightness, tension, like you're clenching your buttocks all the time. You're clenching your belly all the time. You have difficulty initiating the flow of urine, or your stream is slow, or you have leakage because the muscles are so tense, their functioning is off. They don't know how to relax fully to empty the bladder. You may have constipation because these muscles are again tense. They don't create enough space for things to come out through the anus or through the urethra. Or you could also have sexual dysfunction like pelvic pain, whether it is because of the pain on the entrance of the vagina or deep inside the vaginal tube because of the tension in the deeper pelvic floor muscles. So again, based on your assessment, your pelvic floor physio is going to determine what exercises are going to be the best for you, because we have different exercises for superficial pelvic floor muscles and different exercises for deep pelvic floor muscles. So it is so important to have that assessment done if you have, again, the exact access to a pelvic floor physical therapist. But if not, then there are certain safe, safe exercises that anybody can do and not really hurt themselves, like happy baby or child's pose. Some yoga-based stretches are always useful, but I wouldn't go and like try to really stretch things apart, which I see in my patients. Like pelvic floor relaxation does not, you cannot achieve it by really stretching things, or think like if I have like the best hip mobility, that's when I will have the best pelvic floor. Because guess what? We see pelvic floor dysfunction in people who are very hypermobile, like they're very stretchy, and everything. We see pelvic floor dysfunction in them as well. So it's all about a balance, right? Like you should have a nice balance of flexibility and strength. And that's where pelvic physio could be so helpful in assessing and determining what kind of treatment plan is going to be the best for you. Another thing that we can do is, which is like a common term, adhesions in endometriosis. It's because of the local inflammation, that these inflammatory chemicals can create this sticky fluid-like stuff around the organ, which can create adhesions. And during endometriosis surgery, a lot of times the surgeons can also take care of these adhesions, can remove some of the adhesions from these organs. But some of them can still, can be left behind or can create new adhesions because of the surgery itself. So again, I'm not trying to say like, oh my God, the surgery is going to create adhesions, so you should not do surgery. That's not what I'm trying to say. Adhesions can be helped with pelvic physiotherapy. A lot of pelvic physiotherapists are also trained in visceral mobilization, which I do as well. And it's a pretty simple term to describe that every organ can move. It has some mobility inside the abdominal and pelvic cavity. And the physio can actually assess how well these organs are moving. If they're not moving super well, then with physical mobility exercises or movement maneuvers, we can improve or restore the mobility of these organs, which can also help with restoring the functions of these organs. And what are these organs? Your bladder, your uterus, your rectum, even your bowels, if endometriosis is present anywhere around the bowels. So we do visceral manipulations as well.
So is it a specialized field, or any physiotherapist would know the visceral mobility?
No,
is what
you have to do. I mean, I'm still learning to keep improving my skill set. And I started learning in 2016 or 17. So it's been like about 5 years when I started learning the visceral manipulation. And it's a skill set, just like how surgeons also keep on improving their skill set. So not every PT is going to know this, and you have to really go to a trusted physio.
So you'll have to find a good one who does it.
Yeah,
that's a difficult task.
But see, nobody knew about. When I started my pelvic career, I think there were. Maybe I didn't know, but I think I heard of like 3 pelvic practices in the heart of New York City, and within last 5-6 years, it's really booming, and people are really, not just the people, but providers, PTs, they're learning about it, and they want to specialize in pelvic PT. And I think this is a great thing. We need more clinicians who are very
absolutely. Yeah, absolutely. I mean, it's something which it's something like the endometriosis surgeons. You have limited number of surgeons, so you need more of them.
Yeah,
Similarly, you need more of physiotherapists who are
yeah,
doing stuff which is really
yeah.
required now.
And that's why I was so thrilled when I got your message. It was like, yes, India is, finding out about, pelvic physios as well. And I've connected to a few of them, and I think they're doing such an amazing job. But again, like, you don't really hear that.
No, but then that's like amazing. If you could just put drop as a message of who is doing it here, because there are a lot of people being an endo advocate. There are a lot of people who approach you, but finding the right people is something which is very difficult. So if you have,
Yeah. I hope we can create like an endometriosis India physio directory or something,
that's going to be like amazing. That's going to be like
And I
really
can
good.
put on my page, and people who can just like, hey, just let us know if you work in pelvic physio, if you're a pelvic physio and treat endometriosis, just share your info. So I
That
think that would be
will be like a great help. That will be like a great help for the community.
Yeah, no,
Yeah.
I wanted to, because people from India contact me and I'm like, I mean, I can help you virtually, and I do. You can do a lot of things actually, interestingly, virtually. But it's still, sometimes you're limited. You're like, okay, if you can just get an assessment, that would really help me understand your case, and I can help you better.
Better.
So,
Yeah.
yeah.
Absolutely. I completely agree with that. So now, Dr. Mukta, tell me something. A lot of women with endometriosis have problems in having an intercourse, okay, because of the rigidity in the pelvic floor muscles. So does physiotherapy help them? Because
100%.
this is something, yeah, because this is something people don't talk about. First of all, it's like a hush hush thing.
Yeah,
So,
I know.
you know. So it does
Absolutely.
help,
Yeah.
100%.
And I think this is again, it's gonna get me started on a rant, but yeah, why not?
Go on, no
Again, like,
problem.
the problem with the problem in India is, or any, and again, like, I'm not trying to say it's true for any conservative society, and we see this in US as well. Let me just say this. It's not like, everyone is so open about sexuality in US. What happens in India is, like, you are, as a woman, your sexuality is so suppressed. Everyone's sexuality is suppressed, but especially a woman's, because you have to, like, the purity culture has completely taken over, and you're not supposed to even talk about it. Everyone has fear around intercourse to begin with. You get your puberty, and then for multiple years you cannot even think about sex. Like, turn off the switch, and once you get married, you're like, okay, let's have sex because we have to make babies. So the whole idea around sexuality is about making babies, and women are just like
Right.
baby
The
producing
machines.
machines and nothing else. Their sexuality, their pleasure doesn't matter. And a lot of times, because of endometriosis, the way it is first discovered is during puberty, when someone experiences painful period. And now, I mean, I don't know about India, but in US, a lot of times they're quickly given birth control pills. It's like, oh, it's going to normalize your period cycle. It's not going to keep it very heavy, and you will be functional, and it will improve your quality of life. All the power to birth control pills. And for some people, it is super useful, but it's masking your endometriosis symptoms. You're not going to find
Symptoms.
out until you're like, okay, I'm ready to have a baby, and you stop using birth control pill, or you get married and you're like, okay, I'm going to have to make a baby, so let me stop birth control pills. And the pain comes with a vengeance, which has been nowhere to be found because you were taking birth control pills, and you're confused, like, what happened? Is something wrong with my body? Am I not capable of having sex? So there are so many multiple layers when it comes to sex. So I'm just trying to tease out that one is social component, which has suppressed your sexual desires, and it has, like, you don't know exactly how intercourse is supposed to happen. So there could be a part of vaginismus there. But then you have endometriosis that has created this inflammation in your pelvic region, which is causing your muscles to become rigid on top of it. So you're like, okay, I don't know whether it's vaginismus, whether it is pelvic floor dysfunction, or whether it is my endometriosis. How should I tackle this problem, which could be so overlapping? And everyone's symptom is the same, pain with sex. So I would say, number one thing, what we all can do, what is in our power, and as the topic of today's empowering bodies, know your body. Know your body. Don't be ashamed of checking yourself with a mirror, touching yourself, finding what is going on. Do you have pain with touch? Touch with like just at the entrance, or you're like, oh no, touch is okay actually. But if I attempt to even insert a tampon or intercourse, or even if I am trying to enjoy with a sex toy, my muscles get tense up, then we could be probably going in the territory of vaginismus. But if you know you have endometriosis, chances are that you may have overlapping pelvic floor dysfunction, and your muscles are just tensing up because it's trying to protect your body, which is in so much pain. So in that case, pelvic floor physical therapy could be very useful. Again, we don't just like start, like a lot of people think it's just an internal massage and we're just, that's all we are doing. No, that's not what pelvic physios do. We are basically assessing, first of all, what is the root cause of the problem. If your pain is coming from your vulva, or the pain is at the entrance of the pelvic floor, or pain is more deeper inside the pelvic bowl, you know, where exactly is the pain, or pain is basically coming from the uterus, the bladder, or the rectum because of these organs, or the pressure from above is creating this tension in the pelvic floor. That's why it is so difficult for me to just say, oh yeah, we just do internal pelvic floor massage. Because endometriosis is a whole body disease. It's a whole body condition. So we have to really see exactly what all the structures that are involved and how they are creating issues with sex. So we have to first go into the depth, into the weeds of it. Once we have determined, and it's, let's say, like it's the most basic thing. It's the pelvic floor dysfunction. And I'm sorry, like, you know, people who are listening is like, okay, she's talking about everything, but that's what makes endometriosis a complex topic. So if it is purely pelvic floor dysfunction, pelvic floor stretches, mobility of your hips, mobility of your spine, mobility of your pelvis can improve the rigidity in these muscles. You can also learn self-massage to release the tension in these muscles. We also have dilators, pelvic wands to target specific regions in the pelvic floor. And learning that, developing that conscious control over the pelvic floor muscles, where you develop that good control of contraction, but good control of relaxation also. Another common myth associated to pelvic floor physiotherapy is that all the problems in the pelvic area can be dealt by doing Kegels. Like, that's what pelvic floor physical therapy has been thought to be synonymous as Kegels. But it is a huge misconception. If someone has pelvic floor dysfunction, in fact, doing Kegels can make things worse. So do not tighten your pelvic floor even further. You need pelvic floor relaxation. You need pelvic floor elongation, expansion, learning how to create that space. Because vagina is a very stretchy tube. It can stretch so much that it can accommodate a baby, for God's sakes, you know, during childbirth. So you can imagine how much it can expand. So we have a lot of power in our vaginas, and we need to just kind of tap into that power. So I think that's what I would say.
Absolutely. No, that really was required, because this topic needed to be spoken about, and no one better than a physio who has been dealing with patients with problems having intercourse. So, and I'm glad now at least people are starting to talk about it. I mean, like, there is this doctor called Dr. Tanaya who has a Insta handle, Dr. Cuterus, and Dr. Aditi Tandon is there. So I did a session with her the last time. I mean, there are these young doctors coming in and talking about accepting the body, finding, I mean, understanding your body in a way where people can connect. I'm glad the change is coming, but I'm sure it's still going to take a lot of time. But that's how it is. So now, is there um, is there like a certain number of sessions that a person should go for, or you know, are there any precautions that somebody has to go for before going through a physiotherapy, or during going for or going through a physiotherapy session, so that it doesn't aggravate the symptoms that they're having
Yeah,
already?
that's a tough one. So first of all, let me just say that people can take physical therapy before endometriosis surgery as well. And
Yeah.
sometimes this, what we call a prehab, could be actually very useful for people because it depends actually. You know, sometimes when doctors go in and they see whatever is going on, sometimes they also find that there is adenomyosis happening, or the uterus or ovaries or certain organs are not in the best shape. So sometimes they could make that decision that they may have to remove some of the organs. And laparoscopy may sound like, oh, we are just poking just these few holes and we are doing most of the surgery. We're not really cutting you. We're just doing the surgery through these tiny holes with the help of a camera. Great. And yes, absolutely agree that it is less traumatic than, you know, something where you have to kind of cut open the body. But it is still a pretty extensive surgery. And depending on how spread out your endometriosis was. So first of all, be compassionate to yourself, be kind to yourself, and take time to heal. Your inside healing is not the same as your outside healing of the holes that were made, you know. So
Right.
it's not like if my skin is looking fine, everything inside must have healed as well. So generally speaking, 6 weeks is a mark where, like, okay, most of the time 4 to 6 weeks is when body is taking to heal. But a proper healing may take up to 12 weeks, and then complete healing may take even up to a year, you know, after any of these surgeries, which nobody talks about. And I think it is important for you to understand that when you go for surgery, go in with the right expectation that you may need to continue a certain work for improving your lifestyle, your functions. And that's when I said it in the beginning, like physiotherapy can really help with improving your quality of life pre-surgery and post-surgery as well. Pre-surgery, it could really prepare you to understand what changes may happen after surgery, and can, if you know exactly how your body works, if you could learn how the pelvic floor control, could learn the pelvic floor control pre-surgery, post-surgery, doing these things becomes a lot easier. Otherwise, it becomes very difficult for you to, like, I don't even know where these muscles are. I am so disconnected from my body because such an extensive surgery was performed. And everyone's experience could be different in this. So, like, I'm not saying that everyone is going to experience that. If you don't have access before surgery, it's fine. You could see a PT after the surgery, but do see someone for at least assessment and learn exercises. Now, how many sessions? It really depends. Like, again, my patients, if I am seeing them for an hour at a time, and I am doing a bunch of things on them, so I give them the homework and I expect them to be consistent with that homework for a week or sometimes even 10 days and then come back to see me. So I want to give them enough time to practice those things and then come back, and I will do a reassessment and do things differently in that subsequent session. Sometimes people need more support in the beginning, right after the surgery. So I may even see them, although I never see anyone twice a week, except for a few exceptions. But if somebody does want to see me, like, oh, okay, I got this part, because again, complex condition. So we could be only focusing on only one tiny aspect of the problem in one session, and they may want to for a quick learning, for a quick cognitive learning, we may need a quick successive session, so we can give them as many tools as we could, which they can use at home when they are by themselves. So it really depends where the patient is, what their functional goals are, how much they can do on themselves versus they need that guidance in the first phase of their recovery. So how we are giving them this, oh, you know, like two times a week for 6 weeks or 12 weeks, that doesn't really matter. It really, all my patients, I treat them in a very individualistic, I don't have a template that I'm going to see you for 6 times. It really depends. Maybe their endometriotic surgery was so helpful to them that they made such great progress that they needed just some tools and they didn't need to see me for more than 5 sessions, you know. But some people were in so much pain despite getting the surgery that they needed more ongoing support. So it really depends on the person.
So generally, if I ask you how much of pre-therapy and how many weeks before the surgery should somebody see a physical therapist, and how many weeks after the surgery can somebody safely go for a physiotherapy session?
Safe is not a problem. Safe is not the question here. The question is here again, the skill set of your PT, your own accountability of how much you're willing to take on your own, and sometimes how much your body is willing to cooperate at that time. So ultimately, it's the body is the main thing here. It's
right.
That's the one. If it's not cooperating or if it's in pain and you're not able to do exercises given by your physio, I'm not gonna be holding you like, oh, you didn't do your exercises. Like, we have to respect the body. Like, you cannot force it because I gave you a list of 10 exercises, 3 sets of 10. That's not how this works. So the question is not of safety. It's absolutely safe. If your body feels happy, if you're finding help with physical therapy, go for it. Go as many times as you want to, or your PT has decided for you, whatever plan of care you both created with each other. It's not something, we're not in 20th century anymore. This is 21st century, and we are encouraging patients to be equal partners in the plan of care. It's not just like the doctor's or provider's word is the God's word, like, this is what you need to do. It's not like that. We're the guiding force. We are just paving the path for you, and you're the one who's going to go on it. So it's not a question of how many visits safely you can do. I have seen people after surgery, as like within the first week, or, you know, it's not like you have to wait for until certain time before you could go see a physio. Because in that first week, I could teach you a lot of things about your posture, your breath work, just engaging your and just relaxing, and just some stretches and mobility exercises that could be so useful in improving your recovery after surgery. So you could come for a couple of sessions for that, and then like, okay, just do this for 6 weeks and then come back. Then we will go into the weeds of it and give you more extensive protocol or exercises that you could do. So really depends where the person is.
So just like in an endometriosis surgery, we say one size doesn't fit all. Similarly, in a physiotherapy session, one size doesn't fit all. So it completely boils down to, first of all, the kind of condition that you are in, the kind of surgery that took place, and third, and the most important, how comfortable you are at that point in time. So when you were talking about, mobility and breath, there I come to my next question about any lifestyle modifications you suggest which complement the physiotherapy sessions that will help in the healing.
Yeah. Trust your body. It could be very
Most
difficult
important.
to trust the body, especially when you have been hearing all these different narratives about how your body has failed you, how it's not really working for you. you are born with a defective body, defective vagina, defective uterus, all that things you have been hearing or telling yourself. So trusting your body could be one of the most important lessons that you could learn, you know. Uh, cultivate compassion. This is something which does not come easy to us. If a patient of mine is not able to do all the exercises that I give them, the first thought that comes to their mind is like, fuck, I cannot do this. My body is not cooperating, or why is it not cooperating? Or, you know, they kind of become harsh towards themselves. So that's number 2. You have to be compassionate. You have to listen to your body. Number 3, learning about your pelvic floor anatomy, your pelvic floor or pelvic genital region in general, being comfortable, letting go of shame or what the society has been telling you could be really empowering. Number 4, develop this control over your pelvic floor muscles. Your pelvic floor muscles are really important part of structure that support all your pelvic organs. So it can be, you know, if you can just learn this, it could really help relieve some of the tension that you are holding unconsciously and not realizing. Number 5, diaphragmatic breathing. Diaphragmatic breathing, we are blessed that, you know, India is a land of yoga. So like, go take yoga lessons, and from someone who knows, because there are a lot of people who say that they know yoga, but they don't, you know. Really improving your breath, your comfort with your breathing could really help calming your nervous system down, which is so important in endometriosis, and can also help reduce the strain on the pelvic floor muscles. Then just knowing about your bladder, bowel, like, you know, make sure you're not, you eat healthy, you drink plenty of water, but not chugging water. Like, listen to your body. If it's asking for water, give it that water. Pace out drinking so you're not being thirsty for multiple hours of the day and then guzzling down water. That's not how the body works. Some of the Ayurveda principles of, like, you know, lifestyle management, I think are amazing. And we, again, like, it's amazing that Ayurveda and yoga are so part of the culture that a little bit of like taking from those resources could be really helpful in our healing journey. Yeah, just don't be respectful to your bodily urges. Don't hold your poop or pee if you don't need to, you know, respect it. Holding these things also tense the pelvic floor. That's why I mentioned that. So I think that's pretty much sums it up. I'm sure I'm forgetting some, but we can talk about.
Then these were like quite informative. I mean, those pointers that you just gave, I think those are something to ponder about, because like you just said, that you keep thinking about your body has failed you. I mean, trust me, till date, I mean, I being an endo warrior, I being an endo advocate, I still have this thing sometimes, not sometimes, a lot of times, that it gets back to you, you know, that, okay, I used to do so many things, and now probably there are certain limitations which have come into picture. So, you know, you start holding your body responsible for a lot of discontentment that you face.
Yeah.
Yeah, so to get over it, it needs a lot of work, a lot of mental work, which probably you have to do day in and day out, because when you are in pain and you are going through certain issues, it really takes a lot of your, you know, it's more of introspection and a lot of mental power to get over these things.
Absolutely.
And this session was like super amazing, Dr. Mukta. I'm like so happy that we could do this. I really was looking forward for this session, you know. And that's about it for today. In case you want to say some parting words for the audience to remember, I'd be more than happy.
I think just to emphasize that endometriosis is a complex condition of whole body condition. So focusing on just one thing or on one specialist may not really yield the results. and again, emphasizing, I learned this from yoga and Ayurveda. The whole person should be, focused when we are talking about endometriosis, not the endometriosis lesion, how it's affecting them psychologically, socially, how it is affecting them spiritually. So I think that whole biopsychosocial sphere or aspect of health should be focused when we are taking care of someone with endometriosis.
That's beautiful and so amazing. Thank you so very much. And let me just check if the audience has any questions. I can't see any questions per se as yet.
People are just like commenting about the.
Yeah. They're just commenting on it, but no questions. Yeah. Perfect. Great. In case anyone wants to ask any questions, they can put in the comment section. We will be posting this on our page. Then probably you can put in your questions. We'll be happy to answer your questions. And thank you for supporting us so much all the time. Thank you, Dr. Mukta. I would look forward to having some other session with you soon sometime.
Yeah, I would love that. And thank you for making this happen. I absolutely loved it. Thank you.
And I'll wait for the resources from your page.
Yeah. All right.
Yeah. All right. Thank you. Thank you so much, everyone. Have a lovely day ahead. Bye-bye.
Bye.
Bye.